Buenos días con todos.
Good morning for everyone.
Buenos días con todos.
Good morning
Quisiera
for everyone.
saludarlos
I would
en
like to
nombre de
say
nuestra
hello to
organización de orfanatos
you
en el Caribe y
in the name of
Latinoamérica. Soy
RD
Marilena
and
López,
ERCAL
secretaria del
and
Departamento de Vida.
Marielena. I'm the
En primer
secretary
lugar,
of the
quisiera saludar a los
directive
pacientes,
group. I just want to
a
say hello to the
familias,
patients, to their
a las asociaciones de
families, and
pacientes,
also to the
a las
Association of Patients, to
organizaciones que
the
nos acompañan el
Federation,
día de
also,
hoy
and
en
the
este
other
evento que se
colleagues
llama
here
Adopción
in this event where we are going to
Surreal.
be adopting a resolution in order to
Esta
cover
resolución se va
the
a
rare
debatir
diseases.
el 10 de
This
mayo en
resolution is going to
Ginebra
be debated
y ese
on
motivo
May
nos convoca
in
el gobierno
Geneva. That's the reason why we are here in this
bienvenida a
moment.
nuestros
And I just want to say
panelistas,
hello to
saludar a
all
cada uno de
our
ellos.
panelists here. I'm going to
Sin
introduce
más
them in
preámbulo,
a
voy a
brief way.
darle la
And without
palabra al
any further
doctor
ado, I'm going to give the
James
floor
Gerald,
to the Dr.
científico
James, who
es
has
miembro de la OPA y
being his
oficial
member
regional de la
of
OMS en
important
Washington.
groups
Él
in
también es
Washington,
jefe
and
del
he's the
Distrito de Salud
director of
del Organismo
Systems and Service
Internacional
of
de la Salud,
Health
OPS,
and all in
y
OPS,
supervisa
and also
programas de
supervise
apoyo para
multiple
transformar
programs
los
around the
sistemas
world in
de
order
salud
to
nacionales
transform
con el
the
objetivo de
health
mejorar la
systems
equidad y
with the
fortalecer la
goal to
atención
improve them and
primaria
also to
de la
reinforce
salud,
the primary
garantizando
attention in terms
efectivamente
of
hacia el
health
logro de
and
la cobertura
also
universal.
trying to
Entre
amplify
otros
the universal
desarrollos que ha
coverage and
realizado,
other
específicamente
developments he have been
le cedo la palabra al
like
doctor
getting
James,
really
bienvenido
important
y muchas gracias por
improvements. So
estar el día
Dr.
de hoy
James,
con nosotros.
welcome and thank you for being here with us. The
Muchas
floor
gracias,
is
Marilena.
yours.
Buenos
So
días,
thank you very much, Marilena. Good
queridos
morning,
colegas de FCS,
dear colleagues, and
pacientes.
also the patients
Realmente es
here.
un
So
privilegio
honestly, it's a
dirigirme a ustedes
privilege
mañana
that
y
you
hacer este
chose
pequeño
me in
ejercicio
order
que, sin
to
embargo,
work with this, because this is
por nuestras
affecting millions of
circunstancias
people,
parece invisible.
and you know how
Muchos
difficult this has
movimientos
been
han
for
tenido
us.
lugares en las Américas.
So which so
En
it's
nombre de
pretty
nuestra
important
Asociación
this
Española y
topic. So
nuestro director de la
in the name of
Organización
all
Panamericana de la
our
Salud, quería
organization with the
agradecerles
Pan American organization, I just
organizadores
wanna
del evento,
say thank you to
naciones,
all the
gobiernos y
organizers
autoridades
here and
en el Caribe,
also
América
to the
Latina y
members in the
Medio Oriente
Caribbean
Pacífico.
area. Thank you
Según la
for
Organización Mundial de la
opening
Salud,
this
una enfermedad rara
opportunity.
afecta a menos de
And in
uno
the
de cada 10
second
personas en el
place
mundo.
is weird
Y
disease
muchas
is that
personas
which
en
is
riesgo
affecting
alrededor del
one
mundo, más de 100.000
of each
enfermedades
20,000 people,
distintas.
as you already
En
know.
nuestra
And
región
we
de las
have
Américas,
100 of number of these
millones de
disease. And
personas
this
y
means
familias
that millions of people and
la
families,
incertidumbre, la
they are
complejidad y el
affected
aislamiento
by
de
this.
estas
And
enfermedades
this is
causan
pretty
cáncer.
complex,
Más del
living with
70% de las
this,
condiciones que
this. And
comienzan en la adultez acaban
70%
en la
of
vejez,
these
lo que
conditions
hace que nuestra
started
respuesta sea
during a
mucho más
really
urgente.
early age,
Los principales desafíos que
and
enfrentamos
the
se
reason
relacionan con el
of
reto
this
estructural
is
de la
maybe
salud
that condition of the diseases. And we are having
El reto más
different
significativo
challenges in the
es
Americas.
la capacidad de
And the
tener
challenge
diagnósticos sin
here
el
is
diagnóstico
the
tardido
capability to
inexiste.
receive a
Puede
diagnosis
tomar
in an early
meses
way.
o
Sometimes we have
décadas
some delays
para,
for that,
en muchos casos,
and that's one of the reasons we are not
este
covering
retraso
or
es aún
taking
mayor en la
the
mirada
actions that we
rural
need for this.
desatendidas, en
So
personas viviendo en
sometimes there are
zonas de
people in
alta
rural
vulnerabilidad,
areas,
donde
people
para
living
ellos los servicios
in high
diagnósticos
levels of
especializados son
vulnerability.
escasos
And that's the
e
reason
insuficientes.
why maybe we are
Además,
not
estas enfermedades pueden
covering
ser
this.
complejas, pueden ser
Besides to
sistémicas y
this,
requieren
these
atención
are complex
multidisciplinaria,
diseases,
pero
and the
necesitamos saber cómo
conditions
siempre estar preparados
are
para ofrecerlas.
pretty difficult, and we
Seguimos
have to know
apoyando los
how we are going
países
to be
que han
taking
llevado a
care of
cabo
this. We
esfuerzos de
are
recuperación económica
supporting
recientes de
all the
manera
countries
clara
around the
debido a la
world with different
internacional
kind of
multilateral
programs.
y en la
We are trying to
creación
make some diagnosis or some
y el
programs in order to get
establecimiento de
knowledge,
hospitales
real knowledge
que
about
conectan el
this.
conocimiento
So
especializado
this
con
is
la
how
comunidad
we are
que
trying
más
to
lo
use
necesitan.
the
El segundo gran
most
desafío es el acceso al
like
tratamiento.
proper
Cuando se logra un
strategies. And
diagnóstico, el
actually, when
tratamiento
we
puede
get
ser
a
más rápido y
diagnosis,
accesible y sin
the
los
treatment
gastos
maybe is not going to be
médicos que se
available. That's another
necesitan
problem.
los costos.
And or
El
maybe we don't have
90%
enough
de
information
las
about
enfermedades
this
raras
disease. So more than 90% of the weird or rare disease, they don't have a treatment. And maybe if there is a treatment for this, we are not going to be able to pay it because it's pretty expensive, as you maybe know at this moment. So we have to work with policies, including the medicine technologies in order to treat these rare diseases, and also understanding the benefits that the science is bringing to us nowadays. And also we have to be able to negotiate fair prices in order to provide more access to all the people and their families. So we have to understand that this is another or touches another areas like education. Maybe people don't understand how difficult this is for the people, and we have to provide or in somehow try to promote the education in order to understand how these diseases are affecting families and other members. So we need to be focused in an integral resolution, and we have to support the individual in total. The services of mental health also should be provided to them, and also the adaptation or the scholar adaptation, that's inclusion, and that's other topic that we have to understand. In the Americas, we don't have pretty accurate information about rare diseases, and that's why sometimes we don't have enough visibility to try to take care of every single situation. We have some classifications, international classification about this, and also we are having some academic discussions with governments and the civil society in order to understand the real needs of the population. The national policies should be inclusive, and we have to develop the mechanisms to provide clear instructions or clear understanding about what is this about, what we or all the people is facing in these conditions. So for this reason, the perfect resolution with the World Assembly of Health propose a development of an action plan which is going to be directed to a fundamental advance, but its success depends on how this is translated in terms of actions and in terms of understanding with all the organization, understanding the principles and the values in each person. We have to be focused on the people. Second, we have to analyze the capabilities, develop capabilities in order to get an early diagnosis. And third, these like organization or these actions should be equivalent to a resolution that we can provide to all the families in the same way. You know, I talked about or I mentioned about inclusion before. And this includes the civil society participation in order to understand the reality they are having, you know, giving them a proper support. The rare diseases are affecting in a deep way the individual and create some social challenges. But if we work together as organizations, as colleagues, we are going to be able to improve the life quality of all the people around the world. Thank you very much.
Muchas gracias, Dr. James, por esta
Thank you, Dr. James, for this excellent exposition about the panorama in terms of the meaning in the condition with the rare diseases and also with the situation that is living the society. I would like to give the floor to Alexandra Humbert. She is the CEO of RDI, and she is the one leading the resolution around the world with multiple actors, and also she is the one who has been dealing and handling these support or these strategies in order to get a global improvement and also to approve it in the World Assembly. She has been working with this during the last 20 years, and I'm going to give the floor to Alexandra. Thank you for being here, and just let us know the information.
Thank you very much, Maria Elena. Thank you, everyone, Ercal, Diego, for this very kind invitation. RDI is very honored and proud to be with you today. So I will present you somehow a bit of a background about the resolution, and I'm very pleased to have heard from Mr. James Fitzgerald already what it means for PAHO region. So I will elaborate a little bit further, and I will be joined by my colleague Deborah Velen. She's the strategic manager of RDI. So we're going to give you a rapid overview about what is that resolution. I think there is no need to...
Excuse me, Alex, we're not watching the full screen.
Okay. Deborah, can you share you have a full display?
I think you have to exit the presentation and do it again.
Okay. My internet is complicated today. I'm in external meeting, so my colleague Deborah is going to help to share with the presentation. Is safer, but basically I can start already. As it has been highlighted actually by the previous speaker, there are still a lot of challenges for rare diseases. There's perhaps almost no need to recall them, but often the diagnosis of DC, the lack of capabilities to scale up treatment, access to treatment, but also having access to healthcare. So all those challenges are there. And we decided in RDI to advocate, to call for a World Health Assembly resolution. Following, I think in the next slide, we can see yeah, so this is the current challenge that has been already mentioned: delaying diagnosis, difficulty in accessing care and treatment, stigmatization, the financial burdens often by the family, and the social exclusion. And it's very much the case in Latin America, like it is in Africa, and even also in Europe. So I think all those challenges are very common through all the region. So we felt that there was still a need to call for a global coordination to make sure that we integrate rare disease into healthcare system, to put rare disease as a priority in health. And to do that, then we decided to advocate for a resolution. And today it's going to be, it's tabled to be discussed in a couple of weeks at the World Health Assembly resolution. And the WHA will have to decide if they adopt that resolution. In the next slide, I can show you that, for example, this is very much also linked to the United Nations Sustainable Development Goals that many of you must be aware of. And we had that quote from the Director General, Dr. Tedros, that actually said that in order to achieve the Sustainable Development Goal, no one should be left behind. So including people who suffer from rare diseases, just because the disease affects a small number of people doesn't make it irrelevant or less important than disease that affects millions. So based on that, since 2018, the community worked hard. In the next slide, you can see that we had already a resolution adopted in the United Nations in 2021, but this one was very broad in a way that she also addressed social exclusion, disabilities, etc. So 2021 UN resolution on rare disease, and then there was still a need to address those challenges in terms of health it being integrated into the healthcare system. Therefore, RDI with its partners decided to call for a resolution at the World Health Assembly. In the next slide, you'll see that this resolution has three objectives. why basically we wanted it. The first one is because we still need to advance universal health coverage, and to achieve, for country to achieve universal health coverage, they must integrate rare diseases patients in this. And this is really to strengthen public health and social measures to benefit the person living with rare diseases. The objective 2 is to strengthen the efforts of the member state and all stakeholders in order still to raise awareness. In many countries, there are still a lot of questioning around what is a rare disease. So we still need to raise awareness. We very much need to improve diagnosis capabilities, has been mentioned already, and to foster research and development for more therapies for people living with rare disease. Objective 3 of that resolution is to ensure that people living with rare disease have access to affordable, effective, and comprehensive healthcare services. And this is probably the heart of that resolution. And so to achieve those main objectives, this resolution really called for the first time for a global action plan on rare disease, which will provide a 10 years roadmap for countries to take action. So in the next slide, I will also mention that this resolution will have a global impact. Member states often, when they, at the World Health Assembly level, when they decide to really adopt an important topic, they look at the global impact. And if indeed there is a global impact, so not only geographical impact, but also even beyond health. Here we know that all the delay in diagnosis and the problem of accessing treatment creates a huge impact on the quality of lives of people and social integration. And so that resolution also comes from that acknowledgement. And the second aspect, which is very important, notably for the implementation, it would be taking into account the national context. We know that not one size fits all. We know that one global action plan will not, we know that all regions have different disparities, and that's why it will be critical in the development of the global action plan to have those regions that really inform about their reality. So Latin America, for example, will have a huge, I think, implication in really making sure that the reality in Latin America can inform the development of the Global Action Plan. But we'll come back on that. And the next slide, where we are now with I'm going to give you a very quick sense of where we are with the resolution. As I mentioned, it's going to be discussed in a couple of weeks at the World Health Assembly. It has a first milestone already because in February, the executive board of the WHO recommended the World Health Assembly to adopt. So this is 34 member states already that said, all right, we agree to submit that resolution for adoption at the World Health Assembly. I just wanted to also highlight the fact that this resolution is not an RDI resolution. We advocated to have the resolution, but this is a real member state-driven process. So this is 26 member states that co-sponsored the resolution. It was initiated originally by Egypt and Spain, and it had been supported by 24 member states, including several countries from Latin America, like Panama, Ecuador, Chile, Brazil, and probably other, but voilà, the list is there. The other important point I wanted to highlight is the fact that this resolution is also supported by the number actually of those organizations has increased. It's now 260 organizations, including hospital, research center, etc., patient organization, obviously, that are really calling the member state to adopt the resolution. So in the next slide, you can have you can see the overview about the number of those organizations that came together in end of December, early January, and that really see that having that resolution will be meaningful. And it shows also something. It shows to the member state that we have a community that is extremely ready everywhere to take the work that has to be done to develop the Global Action Plan and to implement. But I'll come back on this later also in the panel discussion. The next slide just show you, the three next slide, it was just to show you the number of those organizations. They are all listed there. but we can go very quickly through it. Voilà, this is all those organizations. So it's really something. We have a movement with us, and member states then have really many organizations that can support the work. And this is a very important signal, given also the difficult context of the World Health Organization today with the financial crisis. The two next slide, we can go very quickly. And I think I'm almost done, and then I will hand over to my colleague, Debra. Yeah, I think, no, the next step then, it's the adoption in May. And so we will be, RDI, with many members in Geneva. And then, yeah, we can pass those slides. This is was exactly what the Global Action Plan would be, but we will discuss in the panel. So the next step is the fact that this coalition did release a call to action recently that has been sent to Dr. Tedros at WHO and also to all the different missions, representative of country in Geneva, to show that they're really there. We will have a side event in WHA, the 21st of May. It will be also online, so if you want information to join the event, please feel free to contact us. We will know perhaps or almost on the 21st of May if the resolution is adopted. We are confident, but we know also that there are some challenges. And again, I will discuss in the panel that this will be just the start of our work, because the implementation would be critical. Having the resources and the capabilities will be essential in region to make it a reality, impactful. I think I hand over to you, Debra. Thank you.
Thank you, Alexandra. So I'm going to speak a bit about the engagement of all the stakeholders in the different regions. So I'm going to start by showing you a timeline. So Alexandra spoke a bit about what was happening next. So we have this very important step, which is the actual adoption of the resolution by the WHA, hopefully in May. And also this will lead eventually to the Global Action Plan, which is our goal in 2028. But in that meantime, this is where we really need to engage with all of you in your region and in all the regions to develop this Global Action Plan through consultations. Because it's very important for us that this Global Action Plan not be just a piece of paper, but be something that is really reflecting what is needed in the different regions, and that involves all of our member organizations and other organizations that are allied to RDI and our members. So in terms of how we plan to engage with the regions, you can see these are the four main pillars of how we hope to engage. So the first thing is really to identify the needs and the strengths in the regions. And then after we have determined what is needed, to build the capacity in areas where we need to strengthen the resources that are there. And we need to ensure that the advocates in the regions, including Latin America, have the tools that are needed. And part of this is ensuring that the advocates can learn from each other. So peer-to-peer knowledge sharing and support is very important in this. So we know that in Latin America, there's a really long-standing history of advocacy. We have very strong members. We have very strong commitments from organizations in Latin America. And we know that there are also really strong regional networks, such as all of you here today. And that these are very dynamic organizations led by persons living with rare diseases and that are very committed. But we also know that there is a lot of diversity in terms of the capacity of different organizations and in terms of where different national alliances are in their progress. And so one of our commitments as RDI, and that will also be coming from the WHO, is to ensure that everybody has the technical and advocacy support they need in order to communicate what their needs are to the global level. And part of that is supporting our capacity building through engagement in the different regions. And another element, of course, is to elevate regional voices and national voices in global forums So for example, when we go to Geneva, we feel it's very important to bring some voices of members from different areas to Geneva to speak at that global level. But this is an ongoing aspect, of course, and engaging with the WHO regional offices and with the international offices. And so specifically for Latin America, to ensure that the voices from Latin America are heard and reflected in the development of this global action plan. So in order to accomplish this, we are creating a framework, an advocacy framework, in consultation with our members. So if you belong to an RDI member organization, hopefully you have received a survey, a link to complete a survey, but I will make sure that it's shared with you if you haven't received it. And this is really our first step in identifying the needs in terms of capacity. Because we know that there is already a lot of progress. We don't want to reinvent the wheel. We don't want to tell you things you already know. We want to really build on the knowledge and successes you've had already. And our goal is to create a global framework that is adaptable and sustainable, and that reflects the needs in all the different regions and can be used and adapted in those different regions. And the goal of this framework is to empower our regional and our national leaders to mobilize their own communities towards common advocacy goals through the WHA resolution, the Global Action Plan, and then how it will work at different levels in your own countries. And then another aspect of this is to reinforce the connections and the communication within our global network. So that goes back to the peer-to-peer learning that I mentioned, to ensure that we can optimize advocacy efforts so that we're all working towards the same goal and that we're not repeating things that don't need to be repeated, but that we are also building together this advocacy future, really. And then the last aspect is really to empower our advocates to influence policy decisions by providing them with tools they need. So the first step has been our toolkit that we've created for the WHA resolution, but we will be continuing to provide tools in terms of communicating with your ministries and the WHO and other levels of policy makers that you need to be able to communicate with. So this is just an overview of how the engagement works. So at the top, you can see the Global Action Plan on Rare Diseases, which is at that global WHO-WHA level. And then there are the regional offices. So there's a specific regional office that is for the Americas. And then we have our regional alliances. So we work through our regional alliances, but also through individual national alliances. And then here we have the list of the co-sponsors of the resolution so far in different countries. So you can see that Latin America is quite well represented with Brazil, Chile, Ecuador, and Panama. And we've also had support from other members from other countries in ensuring that this WHA resolution will go through. And then we have our member organizations that work mostly at the national level, but also international federations that are working in one disease area across national borders. So I just wanted to share our QR code. You can also go directly to our website, rarediseasesinternational.org, and you can download materials. So we have all of our materials about the WHA resolution available in English and Spanish and Portuguese. And so if you have any questions about the resolution, you're welcome to look on our website. We have a lot of resources there. So that is a quick overview. And thank you very much for listening.
Muchas gracias, Alexandra y Debra. No presenté a Debra. Debra es gerente de relaciones estratégicas de RDI.
Thank you very much, Debra. I'm pretty happy you have been participating here. I love how we have developing this panorama. The Dr. James has presenting this deep work that RDI has been doing during the last time, and also the advocates of patients have been doing a really good contribution. I just want to congratulate you, Deborah, and it's pretty important to keep working all together. It's important that you get in touch with your mission in Geneva, your direction of multilateral organization, and also ask that your country is going to be included here, or maybe to sponsor these initiatives in order to keep covering the rare diseases. Before going with the panel, I'm gonna show quick information about how you can change the language in this webinar. So try to make sure you are following these steps. So you have to choose the word icon, and then you can see it in the bottom part of the Zoom screen. Then after you click on this button, you can choose English, Portuguese, or Spanish, and then try to silence or disable the original audio in order to listen to one specific language. And okay, now let's do a little panel among partners. I would like to introduce to Diego. Diego is the executive director of the National Institution of Rare Diseases in the Caribbean area in Latin America, and he is an expert of global advocacy, an expert of policy in his country, and also promoting with better conditions in favor to the people with rare diseases. In this panel, you also will see to Anthony, or better known than Tony. He is from the Brazilian Federation of Associations in terms of rare diseases, and always he has been giving us information about the best practices that other countries can give. And also we are going to keep speaking with Alexandra and Dara with the moderation of Diego. So Diego, the floor is yours in this round of questions among friends. Okay, thank you very much. I just want to say thank you to all the people for participating in this space. Thank you to James Fitzgerald and to all the team of RDI, Tony. It's a pleasure and an honor for me in order to keep working about this advocacy work, because this is not a short-term performance. This is going to be a long-term, and for sure we are going to see the results that we are expecting. So I'm pretty happy to see the efforts and the results that in RDI we are going to have, and also living all the junctures that we are living in each country in Latin America, because some changes that in Latin America, they are representing some critical situations, not only in the diagnostic, but also in the treatment. So that way, I will say that this resolution is arrived in a pretty important moment, and also with that call that we are trying to do to the governments and all the organizations to guarantee each supporting the group of patients. So I would like to start this conversation with you. And also, this is going to be like an icebreaker, a quick question with each of you. So what is the things that inspired yourself, or what you were inspired by this resolution? So what do you see behind this resolution? What this can represent to the community of rare diseases? So I'm going to start with Alexandra.
Thank you, Diego. I'm going to be very short because I already spoke a lot, but I was going to say really that it gives hope. I think it's the first time probably that I see so much people coming together that really understand what is at stake, that can really see the opportunity and want to grab it and to say we are here. And so that resolution really said that we are heard I mean, for the first time, we have rare disease at the highest level in the health agenda. So this is at the World Health Organization. And so this is what it means. It gives hope for our community, I think, but hope is not enough. So by having created the coalition as well that I mentioned, 260 organizations, including hospital, researcher, etc., it shows that everyone really wants to be on board and wants to show to the member states and the WHO that they are ready to step in. The rare disease community is full of excellent, expertise. We have also some concrete solution that work. So what we need now is to look at how to scale up. What solution can we scale up, etc. So to me, that resolution, it's a policy. It can stay a paper. It's clear it can stay just a paper, but it can also become a real impactful for change. So this is where we are. We are at this moment where we can grab that opportunity.
Esa perspectiva, gracias Alex.
Okay, pretty good words. Thank you, Tony. What inspires you at this new step about this resolution?
Muito obrigado, Diego, pela pergunta. Quero cumprimentar
Okay, thank you very much for your question. I just want to say thank you to all the people here. And the things that inspire me the most is going to be maybe the recognition around the world about these benefits that we are bringing to the people who are living with these diseases, with the people living with rare diseases. So for me, it's pretty meaningful, maybe the impact that we can get in the society, and also looking for hopeness, looking for provide them to the families, to those families that sometimes are not pretty visible in this, maybe in many scenarios now, they are going to be able to understand that we are working for them and that they are going to be able to receive some benefits, and that's going to be beyond documents, that those are feelings as people working all together, and we are giving our best effort to improve every single day the life of these people. Thank you, Tony, for sharing us. So, Debra, what would you like to add to this inspiration that, for example, Tony and Alexandra is sharing us?
Well, for me, it's really diversity and unity. Diversity because of our community, to see all the different national alliances, the international federations of all different kinds of conditions, the ultra rare, the less rare, and organizations with different levels of resources joining in a unified response and working towards the same goal. And it's also been really heartening to see other types of organizations such as hospitals, academic institutions joining our coalition and showing their support. So I think that's been really inspiring.
Fantástico, porque muchos estamos sumando desde diferentes frentes a una iniciativa que es de...
Definitely, we are working all together in something that is globally understand. I would like to confirm if you can hear me. Yes, can you hear me? Yes, you understand everything. All right, very good. So just going deeper in detail and understanding that for several people around the world, it's difficult to understand in which how a resolution will impact in their daily life. So, and I would like to ask you, Alex, Sandra, from your global perspective, what do you think that is the most important value which this resolution is bringing to the people living with weird, rare diseases, and what we could expect around 12 months after the adoption of this resolution, because we see that people have a lot of expectations because this could improve their lives. What is your perspective? What is the value here?
Yeah, thanks, Diego. So the first thing is, we mentioned it earlier, but it's put rare disease at the highest level on the agenda of public health. So this is already a recognition by itself. It means that people that often have been left, you know, in the shadows have an opportunity to be heard and more visible. But again, it will not just be by having the resolution that they're going to become visible. There's going to be a lot of work that we need to do. The second thing is that it will really create a political momentum for notably Latin American countries to collaborate together and to share the challenges. Also the solutions, because there are some solutions that work in country that could be scaled up and duplicate in other country being tailored. But in the region, I'm convinced that there's a lot of potential going on. And actually, I would like to applaud Chile recently that done this amazing progress at the policy level. So, and the third is it will provide an opportunity to create a unified framework for national action, because, and I will come back to that, there will be the development of the Global Action Plan, where Latin America country will be able, for example, to inform what are their realities, their challenges, etc. And then after, when there will be implementation means that country will have to translate into national action what that Global Action Plan is having it. There will be targets, there will be indicators, there will be some very concrete action there that actually every country will have to report every 2 years at the World Health Assembly. So there will be also an accountability process. And then within that implementation phase and monitoring phase, the region can actually even work closer together by collaborating about the different progress, again, different action that can work. But this will not happen without the engagement of the civil society. And we heard from other disease groups that they had a global action plan, but nothing happened because there was no capabilities on the ground. So it means at national level and regional level, the different actors were not activated. There was no push. So again, like for everything that in rare disease had happened, it's the community, the driver. And we will demonstrate it even during our side event in Geneva, where we're going to show that if we are here today with a resolution, it's because they've been so many work by the community everywhere. And it will have to continue that way. So, and I will come back again in the other discussion of the panel, what can be put in place. But, and so what we can expect in the next 12 months, first, the adoption in May, hopefully, but be aware that there is a very difficult context at the moment at WHO. And if it's adopted, there will be, WHO will have to provide dedicated resources to start consulting with all the different stakeholders. We don't know exactly how they're going to do that. Usually it's formal consultation process, etc. But basically our community will have an opportunity to provide some formal submission to inform what the Global Action Plan, etc. should be. It's 2 years, the development of that Global Action Plan. So 2 years of development, so a lot of consultation will have to take place. So I'm sure we'll have another webinar again, definitely. But at every region, if we can have the same push, it's where we will be able to give a chance to have a very meaningful global action plan. So development phase and after implementation phase, after 2028.
Fantástico, Alex, y emociona mucho todo lo que mencionas. El
Okay,
poder
thank you for your words, because this is just the understanding that we are going to be able to materialize or visible benefits. So Tony, Brazil has been working several years in promote public policy for rare diseases. In what way with your group or your community you understand that this resolution could be would bring benefits to your country, and what could be the recommendations that you can make to the government, not only in Brazil, maybe in other parts of the world, in order to get this unified groups of participation. What do you think about this?
Realmente, o Brasil tem
Okay,
promovido várias
honestly, in
políticas
Brazil, we have been
específicas
promoting
voltadas
several
às
public
pessoas que vivem
policy,
com
which are
doenças
pretty
raras.
important for the
Com
people
diretrizes
living with
nacionais,
rare
parcerias
diseases, with
público e privado
national
e a construção de
alliances, and
centros de
also with
excelência,
several
como a Casa dos Raros, que já
groups
funciona há
of
mais de 2 anos.
communities,
A
organizations
resolução
working
da ONU
towards this
representa
goal.
marco
And
global
also, we are
que
trying
pode
to
atuar como
establish a
catalisador
global
poderoso
framework
para
which is
estabelecer
gonna
referencial
catalyze in a
internacional
powerful way,
que
and also
legitima
with
a
international
resposta à
reference, and this is
urgência
gonna
desse tema.
legitimize
Ela
each
convida os países a
effort that
tratarem das
we are
doenças
doing,
raras não
promoting
como
the
questões isoladas de
countries
saúde,
to
mas como uma prioridade de
implement
saúde
this kind
pública
of
e de direitos humanos.
strategies
Aí
that
duas
we are
funções
trying
concretas que o Brasil
to
pode
implement
colaborar.
and understanding in a better way the human
A
rights.
importância da
So
colaboração
it's
multissetorial.
pretty important, the
Uma das
multi-sectoral
estratégias mais eficazes que o
collaboration,
Brasil
the
tem sido a
implementation of
construção
all
de
the
pontes
strategies,
entre
and that's the
associações
thing
de
that we are trying to
pacientes e
communicate to the
instituições
government,
públicas
and
e
about
também
how
empresas
we can
farmacêuticas.
benefit
Essa abordagem
the
coletiva
patient from the
tem viabilizado
pharmaceutical
avanços
sector,
regulatórios
from the
e
government
políticas
sector,
mais
and
alinhadas
let's
às
say
reais
that we have to
necessidades das
create
pessoas com
more
doenças raras.
aligned policies
O segundo
to promote
ponto,
more benefits. The
modelos
second
integrados e
point is going
sustentáveis
to
com
be
cuidado.
create some integrated
O Brasil também tem
modules.
avançado na
In,
construção do
in
novo
Brazil, we
modelo
have
que une
been
o SUS e
building
o
some
sistema único de
modules
saúde
to
a
connect the
parcerias
different
filantrópicas e
sectors,
privadas
and
para
that way
oferecer
we have been
cuidados
promoting the
abrangentes e
public
de longo
and the
prazo.
private support,
Esse modelo pode inspirar
and
outros
that
países
module
a
could be
pensarem além de
implemented in
projetos
other countries
pontuais
in order
e
to
investirem na
invite
solução sistêmicas e
these
duradouras.
sectors or
Por fim,
to
a resolução
implement
da
a
ONU
possible
oferece
resolution that
uma
could be
linguagem comum pela
similar
primeira
in
vez.
several regions.
Independente do espectro de cada
So,
país, dos desafios,
independently
vamos ter
of the
uma linguagem
challenges
comum
that
e
each
também ela
country can
oferece o
has,
impulso
I'm
necessário
completely sure
para
that
promovermos mudanças
promoting this
concretas
module,
juntos.
we are going
Ela
to be
fortalece
able to take
países como o
care
Brasil
of
e
our
incentiva a
challenges, taking into
solidariedade
account the
global na
situation that
luta
we could be
pelas
living
doenças
here
raras.
in Brazil.
Fantástico, Tony. E inspira mucho también ese camino que ha trazado
Okay,
Brasil a lo
Tony,
largo de estos años
pretty
para
meaningful
países como
words,
los nuestros, porque
taking into account the
ha logrado
situation that
lograr
maybe
cosas
in Brazil
interesantes
you
y
are
seguramente esta
living.
resolución va
So
a ayudar a seguir
this can
impulsando
create a
estas
roadmap
iniciativas, como
in
dice,
order
de
to take
colaboración
into
entre
account each
diferentes actores, que es
situation
lo
that could be
más valioso
similar
que debe haber acá.
in the different
Débora,
countries in
desde
the
la
regions.
perspectiva,
Deborah, from the
bueno, nosotros sabemos
perspective,
que RDI
we know
articula
that
en este momento a más de 100
RDI
organizaciones de
articulates more than
pacientes a nivel
100
global,
organization of
muchas de
patients
ellas de origen latinoamericano.
globally,
Frente a
many
esta
of them
resolución,
from
¿qué
Latin
papel deben
America.
asumir
So
estos
taking into
grupos
account
u
this resolution,
organizaciones de
which
pacientes
paper
para
you should
transformar el texto de la
assume
resolución
with
en acciones que
your
sean realmente
community
medibles
or
y tangibles
patients in
en los
terms
diferentes
of
países? ¿Sí?
measure
Y si esto no quede solamente en el papel, ¿sí?
measure
Y
actions or
también
measure
qué apoyo consideras que deben tener
results, and
estas
also which
organizaciones de pacientes para
support
poder
these
impulsar
organizations
con éxito
need
esta
in order to
resolución?
promote more and more this resolution.
So I think that the first step that the patient organizations really need to undertake is to identify the needs. What are the main needs in their communities? And from there, what are their priorities? Because, as Tony was saying, a roadmap is really important in different countries, and we know that different countries are starting from different points. So there is no one size fits all in terms of what this global action plan will mean. And what will be really important is for the patient organizations to engage at the global level to really say what their needs are from that national perspective. And that can be done through the regional level, through the regional offices, through the regional alliances. And but it's very important, I think, that those needs and priorities are identified for each individual country so that we really ensure that no one is left behind. Because if we start from a point that maybe is appropriate for Brazil, but isn't appropriate for Ecuador, they won't get what they need. So that's something that I think is really important, is to start with perhaps a mapping of what's happening in different countries if that doesn't exist so far, and to really speak to your individual members in your countries to learn what their priorities are. And this is something that RDI will be able to help with, as I was saying, through our advocacy framework. So I encourage the national alliances and regional alliances to engage with RDI in undertaking this mapping and this identification of needs and priorities.
Muy interesante, Debra, lo que nos compartes. Y
Okay,
también
pretty interesting, Devran, and also it's pretty worthy for us the whole support that we have for these patients around the world about how we are going to be implementing these strategies or becoming real, you know, implementing each initiative. And now, just to close this space of final question, where I ask you, please be brief when you answer. So, which concrete action you consider
proponer o
that we have to propose or suggest to the people that is connected to this webinar, which concrete actions or what concrete actions they could follow or they could do today or tomorrow to promote this resolution. So what they can do, the people here in this session, to promote this resolution. So Alex.
Okay, so but basically, we should not be too optimistic and assume that the resolution is going to be adopted. So I would say that it's still the moment to call for member states to adopt the resolution. Even more, as I mentioned, in a context of a lot of difficulties at the United Nations level with financing. So we have a call to action that has been released. We have it mentioned. So if any of the organizations that are participating here have some contact also with their member state that are still not co-sponsor, so we have 4, I think, 5 from Latin America. So we still can have more. It's still the moment to do it. So we have a template letter that can be tailored if you wish to contact the Ministry of Health. At the moment, it's still very much the Ministry of Health that is the key player. And I would say that after there would probably be some work to do in Latin America, notably with PAHO. So I was very pleased to see that a representative of PAHO was there already. But also with finance ministers, there would be the issue around the finance, about how are we going to finance, you know, the implementation of the Global Action Plan. This will be there, but let's not start with that question first. I think political will is still the key and the driver. So I would suggest that you continue with RDI and with ERCAL, with all the different also organizations that are part of the coalition. I think most of many of our members in Latin America are part of that coalition. So let's use that. Let's show that we have more than 260 organizations that come together and speak in one voice and are ready to take action. So, voilà. Thank you.
Gracias, Alex. Tony, ¿cuál es la invitación que le harías a los
Okay, Tony,
asistentes?
what is the invitation that you can do to the attendees to promote this resolution? So it's going to be a concrete indication that you have to understand pretty clear these dynamics, and you have to try to participate in every single activity that could promote this kind of initiatives. So you have to understand that this is going to be a national policy that we can create by ourselves. So after you understand how this is going to be working, you are going to be able to participate actively from your first cycle. It doesn't matter which is, but also you are going to be able to promote specific information about how important this could be. And this is going to be impacting every single community where you belong in. And if you do this, we are going to be the strongest movement in order to promote it and make it understand that this is not a problem of a few people. This is the responsibility of all of us around the world.
Gracias, Tony. Finalmente,
Thank you, Tony.
Debra.
And finally, Debra.
So I encourage everybody to do everything you can, just following on what Tony and Alexandra said, to raise awareness and in a general sense. So you can participate in our social media campaign, obviously, to spread awareness of rare diseases. But I think this is something that you can do also on your own in many, many different ways, because I think it's really important for the whole global community to understand that rare diseases are not something of just a few. We are few, but we are also many. There are millions of people that are affected by rare conditions around the world. And so I think that it's important for everyone to understand why rare diseases should be and must be a global health priority. And I think that that's something that we can do at the macro level. We can do it on our social media, but we can also do it when we speak to people around us, so that they understand, because everybody knows someone who's affected by a rare condition, but not everybody knows it. So I think it's really important to show everyone in the world that we are all part of this larger community that is global and that affects everyone.
Muchísimas gracias. Y bueno,
thank you very much. I just wanna make a quick words, just understanding each word that you say. We are pretty inspired. Alex, you were giving pretty important words, and that generate us passion, and that's create or reinforce our intention to make it real, to go there and to participate actively in each part of this process, and that need to work in the diversity. Debra, you talk about diversity, and I will say that that's really important to all of us to understand every single member, and also providing access to these benefits, because it doesn't matter where your passport is, but it's going to be a human purpose that we are trying to get here. And also we have to conserve this, we have to be optimistic, and that's some words that Alexandra mentioned, which are pretty important. And a beautiful word is the awareness. We have to generate or create this awareness not only in the community, but also to the people who maybe haven't been affected by a rare disease. So thank you very much, Alex, Donnie, Debra. We will keep working pretty hard with this resolution there in Geneva. Thank you very much, Maria Elena. The floor is yours to close the session. So it's pretty fast, the time this webinar finishes, and a special greeting to the attendees, their families, the ones who joined to this meeting. And also I would like to say thank you to the General Director, to the OPS, Carvajal Barbosa, in the office of the World Health Organization. So thank you for being working and for being involved in this common purpose as civil organization. Alexandra, thank you. Diego, Debra, again, thanks to all the team, because without you, this couldn't be possible. Thank you very much.